I will move on to let's talk about some of the gaps in the pediatric guidelines. And I'm a pediatric PA, so I actually noticed a lot of things that were very different from these guidelines based on what we had previously. Again, I think it's always going to go back to these were shortened, these were condensed, but we still have to have this lens of understanding what these guidelines are for. They are ultimately at a government level for funding for policy. And so a lot of these guidelines are going to help drive the SNAP program, the school food program, and elder care assisted living facilities, and how and what is required to, be given to those patients to feed them appropriately. And that's where I think a lot of the concern with how shortened and how condensed this was, that at a policy level, it's insufficient. And so, especially in the pediatric space, I found a lot of things were missing that could have been very helpful for our patients and for education. So, Catherine, do you want to mention anything that you might have noticed that was missing for pediatric guidelines?
Absolutely. Absolutely. No, I would love to. I think one thing that was missing that had previously been included in our last version of the dietary guidelines was that there really wasn't any guidance in the infant section on breast milk handling or storage. And the current dietary guidelines did a really nice job encouraging breast milk consumption among infants, and if it's not available, to selecting iron fortified formulas. But it is really important that that breast milk is handled safely and appropriately to assure the health and well-being of the infant. So I think a reason why, as we've previously discussed, is that when you're condensing this document down significantly from that 150 to the 11 pages, things have to get cut. And unfortunately, that was something that was cut. And I think it's concerning that it was cut because infants are so vulnerable and so susceptible. Their immune system is rapidly growing and developing in that first year, but it is not optimal. So they are very much at risk to any type of infection, and then they're very susceptible. So we really want to be sure that that breast milk was handled appropriately. So I think that was an omission that we do want to be aware of, and hopefully it can be addressed in future versions.
I think another thing I noticed that you mentioned safety and how precious and vulnerable these young infants are. The lack of the mention of avoiding honey in infants under 1. I didn't read that anywhere in the guidelines, and I think that's really, really important for our patients to know and to understand. The other thing that I didn't really find, unless maybe you guys did from digging through it, was there wasn't much specific recommendation on consuming iron-rich foods for infants and young children. They kind of just mentioned it, but in the previous guidelines, it was a heavy focus. And so I'd love your thoughts on maybe why they didn't mention it, or how we can educate our consumers on the importance of iron-rich foods, knowing that a lot of our children are iron deficient.
I'll defer to Catherine on this.
Yeah, no, absolutely. I'm more than happy to talk about that. They did. So I did see that they did mention iron as well as vitamin D, but it was, I agree, Colleen, in a very, very brief way. Whereas the prior versions really emphasized the importance of iron, food sources, how it can be incorporated into the diet. Why that was, again, I think it gets back to what we keep saying about this version being much more succinct. But I think it would be really beneficial to discuss those points, especially because clinicians and caregivers, they want typically what's best for their child, for that pediatric patient. So providing education on not only the different food sources, but also the different types of food sources and the impact that they have on the human body, such as what I'm referring to here is like our heme versus our non-heme sources. So our heme sources are going to be those animal-based sources of iron, and our body is able to absorb and utilize those sources much better because they are much more bioavailable. So I think really having content and education about that in the dietary guidelines would be really important, because we see iron deficiency quite common, not in the first year of life, but really as we progress on into years 2, and then even progress on into the toddler and preschool years.